Hi everyone, welcome to the YouTube channel fmge Dr. Aman. In this video, I'm going to talk about the kidney surgery for the FMG examination, how to read the kidney chapter with respect to the urological surgery. So when we start to read the kidney, first we need to know about the brief anatomy. In the anatomy, we must know the relation of the kidney with respect to the other organs, like what is found in posterior to the kidney, what is found anterior to the kidney. So you have to know about the relation of the other organs with respect to the kidney. Then you have to know about the vascular supply of the kidney. Vascular supply is very important. Mainly you have to know about the renal vein, I mean the left renal vein and right renal vein, because we have some pathology related to the left renal vein. So read about that. And yes, after anatomy, the when we talk about the proper kidney pathology, first you have to know in the very great details about the hydronephrosis. It is very frequently asked every time, and you have to know each and everything about the hydronephrosis, their grading, their the X-ray, their ultrasound, their CECT image. You have to know each and everything about the hydronephrosis. In the same way, you have to know about the renal stone, each and everything you have to know. You must able to identify the renal stone on the CT scan, on the ultrasound, on the X-ray as well. So read renal stone, types of stone, and their treatment as well. So in very great details. In treatment, they will ask generally with respect to the size, like tumor. Sorry, not tumor. I mean the stone. Stone size is 2 centimeter. What will you do? If stone size is just 2 mm, what would you do? Which kind of surgery you may proceed with? So they will ask such kind of questions. So you have to read stone in very great details. In the same way, pyelonephritis as well. In the pyelonephritis, they will ask you anything. You have to know each and everything, even the surgery. We have the pyeloroplasty surgery, that as well. So these topics are asked very frequently. So you have to know each and everything about these topics. Okay. And yes, and one more topic, that is renal TB. This is also asked very frequently. So you have to know each and everything about this. Their X-ray, their the gross image. If sometimes they ask, they will give you some hint. They will not give you image, but they will give you some hint. So you have to know each and everything about these four topics. Okay. And then when we come to the so few topics is like very little topic, but they generally ask the X-ray image most of the time, and little bit theory they ask. So first is the duplication of ureter. Okay. So in duplication of ureter, you must be able to identify on the X-ray. Mainly X-ray, you must be able to identify the duplication of ureter. And this sign ask, that is drooping lily sign. You have to know about that. And then of course the Weger to Mayer rule. Okay, Weger to Mayer rule, you have to know about the duplication of ureter. They ask most of the time. So in the duplication of ureter, you must be able to identify the X-ray image. Okay, their treatment, and Weger to Mayer rule. You have to know this much about the duplication of ureter. Then we go to the other topic. Of course, after that we have what to say. Weger to Mayer rule. After that we the horseshoe kidney. You have to know about the horseshoe kidney. Okay, they will give you the X-ray image, and you must be able to identify that image of the horseshoe kidney, and their complication and their treatment they ask. And generally they ask what is the cause of this the horseshoe kidney. What is the cause of this? Okay, so you must be able to answer that questions. Must be able to identify the X-ray about the what is it, the horseshoe kidney. After that, they generally ask about the ureterocele. Okay, in ureterocele, see, in the same way, they will give you the X-ray image, and they will ask you to identify. Like in my examination, they gave the ureterocele image, and we had to just identify the image. That's it. So you have to know about the ureterocele. Okay. Then you have to know about the retrocaval ureter. Okay, like the J-shaped fish hook sign, they generally ask about the retrocaval ureter. So the same way, you must be able to identify the X-ray. And there are some not some, like the with respect to the theory, you must be able to know a little bit. Like suppose if they would not give you the the X-ray, and they will just write the X-ray feature in the question. So you must be able to even know that as well. So read about that. And yeah, so retro cable is done. And after that, yes, polycystic kidney disease. Polycystic kidney is very important. You have to know in the great details, like we have the two types, adult type and infantile type. So you must be able to answer both of that. Okay, so read about that as well. Generally they ask about the genetic involvement in both the types. So read about polycystic kidney disease as well, and their CT scan image they ask most of the time. Okay, then they ask about the Swas abscess. Swas abscess they ask most of the time, because this is the differential feature of the renal colic. Okay, the renal stone and the psoas abscess. So read about psoas abscess. They will give you the generally the CT scan image of the psoas abscess. So read about that as well. And then you have to know about the one disease, that is retroperitoneal fibrosis, named as Ormand's disease. Okay, like we have the Maiden-West deformity on the X-ray. So you must able to identify the Ormand's disease on the X-ray. Okay, the Maiden-West deformity. So this you have to know. And the next topic is the vesicoureteral reflux from the pediatrics surgery point of view, and this is very important. You have to know the grading of vesicoureteral reflux. Their gross, I mean not gross, they will give you just the diagrammatic representation of that grade, and you must be able to identify the grade of that vesicoureteral reflux. Okay, and you must be able to know about the, you must be able to identify that on the gross examination, gross image, and what to say, and their treatment is very important. What is the initial step, what is the final step? Okay, so read about vesicoureteral reflex in details a little bit. And yes, and one more topic, it is the posterior urethral valve. Okay, read about the posterior urethral valve. It is the pediatric surgery. This is also asked, like the keyhole sign. Okay, so read about that as well. And then you have to know about the some like the cyst and tumor of the kidney. In cyst, you have to know about the Bosniak classification of cyst. You have to just know the name of the classification, and little bit as much as you can remember, just know the name. Okay, and how to identify the cyst and a tumor, you must know, like cyst is it is very rounded kind of a structure. It is homogeneous structure, and tumor is not rounded and homogeneous. They must be heterogeneous. They are not very spherical type. So you must be able to identify that this is cyst and this is tumor. Okay, so read about Bosnia classification of cyst. And in tumor, you have to know about the HCC in very great details. All the types of, not sorry, HCC, this is RCC. So read about the RCC, the renal cell carcinoma, in the great details, each and everything about the RCC. Okay, then there are two tumors that they generally ask, that is the angiomyolipoma. Okay, and this is relation with the tuberous sclerosis. So read about the angiomyolipoma as well. Okay, RCC, angiomyolipoma, and one more, that is the oncocytoma. Okay, you have to know about the oncocytoma as well. So three tumor you must know: RCC, okay, angiomyolipoma, and oncocytoma. Read about these three tumors. RCC, read in very great details. Angiolipoma, they generally give you the CT scan image. Okay, so CT scan image you must be able to identify about the angiomyolipoma and their relation with the tuberous sclerosis. Okay, and oncocytoma. So these three tumor you have to know. So this was all about the, yes, and if you talk about the kidney trauma, you have to know the zone of retroperitoneal injury. We have the three zone of retroperitoneal injury. So you have to know about that. Read about the kidney trauma as well. Okay, from the trauma, okay, the grade of the trauma, they will give you the they will write you like the subcapsular hematoma is present, laceration is 3 centimeter, in which grades it belongs to. Okay, so read about the renal trauma as well. So I think this was all about the renal surgery chapter. Okay, this much is enough. I think it's a little bit large chapter, so but it is very scoring chapter, so you must be able to answer all those questions. So this is little bit lengthy, but very productive. So read about this and go and solve an PYQ of NEET, FMG, and INSET as well. And I think this is enough. So thank you guys. Good luck. Bye bye.